As a veterinary practice owner, I find that one of our biggest challenges with clients is being able to practice at the level that we were trained to. Our hospital works very hard to practice at an academic level, but the cost of veterinary care is expensive. So to help our clients, we educate them about having their pet insured so that they're not in a position when we make a recommendation for a large procedure or an expensive treatment to have to consider the financial aspect of that.
Pet insurance really allows owners to be the types of owners that they really want to be. So they want to do everything. I don't think I ever have an owner that doesn't want to do the right thing, but unfortunately I have to often make tough decisions because of their family and their situations on what kind of care they ultimately can provide.
By having Trupanion pet insurance, you're only having one conversation with the client, and that's providing the best care. So the barrier of providing all the different types of options based upon financial needs of the client, that's all been removed. And so you automatically can provide the best care.
Usually with those with insurance, I only have to give them the best recommendation the first time and we go forward, versus a conversation potentially with somebody that's uninsured. I have to go through multiple diagnostic options. I have to go through more in-depth costs of treatment, an A, B, and a C option as far as diagnostics and treatment, which also takes up more time in an exam room, so can really streamline the process for treating an animal.
The most important thing to me is to be able to do what I got into this industry to be able to do, to be able to see these pets get better and to be able to help these owners through difficult times and have a rewarding medical career. When we turn into financial advisors for our clients and we're having to cut corners and not do the right thing for the animal, it's very frustrating for me. If I have a client say no to me, I don't know what to do. So when I walk into an exam room and I see an animal, I want to be able to help them, and I don't want money to get in our way. Trupanion offers us the ability to, with a physical exam on a pet, give an owner a 30-day trial certificate. So we can insure a pet from the day forward of activating that. That allows them to explore the costs of a policy, as well as know from that point forward their pet's going to be covered for any accident, illness, or injury. With our practice, what we have adopted is a mentality of we expect the pets that come to us to be insured. And if we approach every owner and every animal with the expectation that they're going to insure their pets or that they've already been insured, it allows us to have multiple conversations with a client to introduce the idea. So there's not just a standard sales pitch that happens in an exam room. We start out with when the client calls to make an appointment, we ask them if they're a new client, who is your insurance carrier, so that we can file your insurance claims for you. If the majority of the pets that come to us are not insured before they get here, that's just planted the seed with the client that that's a discussion that we're going to have. When they come in, the question is asked, who is your pet health insurance company? Again, another talking point for our receptionist to start discussing that with the client. It lays the groundwork that this is an expectation, just like previous medical records or vaccination history, that this is part of something that we're going to discuss. From the time the client goes into the exam room, it's the technician that will ask the question, do you have pet health insurance and who is your carrier? Since the majority of the pets that come to us are not insured, this is a very easy roadmap for us to then introduce to them who the insurance carrier is that we would recommend and have a conversation with them about why it's important for them to insure their pets. So before the doctor comes into the exam room, while a technician is taking a history and asking the appropriate questions, they do talk about insurance at that point. They mention Trupanion's name, they talk about a 30-day trial certificate, they talk in general terms about how the insurance works, that it's one simple plan with 90% coverage, that there's no caps to the coverage that's provided for the pet, and they go over those general talking points. That seal of approval is critical. I do not feel that our clients would be the type of people who would go out and seek this out on their own. And I don't feel that it's appropriate as veterinarians for us to just say, oh yeah, insurance is a good idea, go figure out which one yourself. I do believe that we need to believe in the product that we're talking about. It's the same with a dental recommendation or a dietary recommendation or a medication that we're administering. If we are not putting our seal of approval on it, the client's not going to trust it. when I come in as the veterinarian to the exam room and have my exam and make my recommendations, I then touch on this again. Have we already talked about pet health insurance? Are we activating a 30-day trial certificate for you today? Do you have any questions about this? Can I explain the importance of the health insurance, or is there anything else that I can talk to you about? So the majority of the conversation happens before I come into the exam room. This decreases the feeling that you have a veterinarian that is selling a product, but strongly making a recommendation, demonstrating the importance without it being a sales pitch. So once we've discussed with the client the importance of the activation of the trial and the client has agreed that they would like to move forward with the trial certificate, we talk about how important it is to activate that within 24 hours of the actual exam. We will assist them by having them call Trupanion from the exam room or from the front desk and walk through the process of the activation with them and make sure that they leave the hospital with their Trupanion policy number. Without the activation, within 24 hours from the time of the exam, then the policy is null and void. And to me, I look at this as a long-term investment in the patients that I'm taking care of. So when I see a young, healthy puppy, and I know that I'm going to see it for the abdominal explorer before it's a year of age, and the OCD lesion in its shoulder when it's 6 months of age, and eventually when it's 9, it's going to be diagnosed with a cancer, I would much rather know that the entire path of that life of that animal is going to be covered and taken care of, and that every time I'm faced with a new illness or a new disease or a new procedure that I need to do, that I'm not going to have to re-go through this conversation. So it's not just a product that I think that I'm presenting to the client, it's a protection for the pet, and it's a protection for my future as a veterinarian and my ability for my practice to succeed.
Trupanion has enabled us to remove one of the big barriers that we have with the client-patient bonding, and that's by removing the economic euthanasia factor. So many clients have to put their pets to sleep because they no longer can afford the best care for their pet. By having Trupanion insurance, we can make recommendations to keep your pet alive healthier, longer, and continue that bond.
I don't think I've ever, with any animal that's had pet insurance, I've been able to do exactly what I've recommended versus a lot of other cases. I recommend something and I get a lot of hesitation of saying, well, I'm not sure I can afford that. Anytime I've had a pet with Trupanion, there's pretty much been no question about, yep, that's what we're going to do, and move straight forward with the appropriate treatment and diagnostics.
We're in this industry to care for pets, as all veterinarians are, and we want to be able to provide the best medical care to these animals. And the roadblocks to that are usually either a lack of owner responsibility or a lack of financial ability. So if we educate a client to be able to provide the best care for their pet from a financial perspective, then we are able to do what we went to school for and what we have decided to dedicate our careers to.